Welcome to the State Health Benefit Plan's 2014 Retiree Option Change Period Overview. My name is Ashley Mingwasser, and I'm here to walk you through some important information concerning your retiree option change period for the 2015 plan year. In this presentation, we will be covering updates to the 2015 benefit offerings, as well as some logistics related to making your selection for the upcoming plan year. Specifically, we will discuss the retiree option change period dates and retiree responsibilities, Medicare Advantage preferred provider organization changes for 2015, including new plan options and benefits, and 2015 changes to non-Medicare Advantage plan options. Our annual retiree option change period this year is October 27th through November 14th. The website will be available from 12:01 a.m. on October 27th and will close at 5:00 p.m. on November 14th. Retirees can make their benefit election at the website listed on this slide. You are encouraged to read the Retiree Decision Guide as it contains important information about benefit changes for 2015 and outlines the steps retirees need to take during the retiree option change period to make their election. This guide will be posted on SHBP's website. You can make your election online at the website listed on this slide or by calling the SHBP Member Services Center at 800-610-1823 for enrollment assistance. It is important to remember that you may go online as many times as you like, but the last confirmed election at the time the retiree option change period closes will be your election for the 2015 plan year. You should print and keep a copy of the confirmation page, which will include a confirmation number. If you cannot print, be sure to write down your confirmation number. This number is proof of the election you made should there be a discrepancy between State Health Benefit Plan or SHBP records and your election. Once open enrollment closes, you may go online to see the election you made and how you answered the surcharge question. It is important that you update your password before open enrollment begins. Your password expires every 45 days. Log into the SHBP enrollment portal now to set up your new password. If it's been over 45 days since the last time you logged in, you'll be prompted to create a new password. If you do not know your current username or password, click the Forgot User ID or Forgot Password link from the login page. It is important that you understand your responsibilities as an SHBP member. Please read all of the plan documents carefully, including the Retiree Decision Guide, SBC's Summary of Benefits and Coverage, SPD's Summary Plan Document, and other tools posted on SHBP's website. After the retiree option change period, please check and verify that the premium deduction amount is correct. If your premium is not deducted from your retirement annuity, you are responsible for paying your premium on time to ensure your coverage is not canceled. If your address needs to be updated any time during the year, make the correction online or call SHBP Member Services. For most qualified events, please notify SHBP's Member Services Center within 31 days of the event. And remember, if you are Medicare eligible, you must continue to pay your Medicare Part B premium to continue enrollment in a Medicare Advantage plan option. If you do not take action during the retiree option change period, retirees who are currently enrolled in a Medicare Advantage preferred provider organization plan option will be defaulted to the equivalent United Healthcare Medicare Advantage preferred provider organization plan option if an election is not made, standard or premium. If you are currently enrolled in the TRICARE supplement in 2014 and you do not make an election, you will be enrolled in TRICARE in 2015. You may continue health care coverage at retirement if you have 8 or more years of service with a state retirement system. Please be sure to read through details regarding your eligibility for receiving future annuities. To receive continued coverage as an annuitant, you must apply for yourself and covered dependents within 60 days of the date your coverage as an active employee ends. Annuitants may request to change plan options if the request is made within 31 days of retirement. If you are below the age of 65 and retiring, your coverage will roll over into your current option and tier selection. Your options are the same as for active members. If you or your spouse are 65 and older at the time you retire, or at any time during the year you or your spouse reach the age of 65 and have provided SHBP with proof of Medicare Part B enrollment, you will be enrolled in the United Healthcare Medicare Advantage Standard Plan under your current tier the month that you or your spouse reach the age of 65. If you would like to enroll in the premium option, please visit the SHBP enrollment portal listed on the screen. So what is changing in 2015? In 2015, United Healthcare will offer SHBP retirees two Medicare Advantage plans, a standard plan and a premium plan. These plan options are comparable to the Medicare Advantage plan types that you have available today and that you may have had with United Healthcare previously. Both plans are group Medicare Advantage PPO plans that include medical and prescription drug coverage. With these preferred provider organization or PPO plans, you can go to any doctor or hospital in the U.S. as long as they participate in Medicare and accept the plan. Plus, you pay the same copayment or coinsurance regardless of whether the doctor or hospital you use is in-network or out-of-network. Please note that the Centers for Medicare and Medicaid Services, CMS, requires a street address. Eligibility for enrolling in a Medicare Advantage PPO requires a Medicare number, so please be sure to have this prior to the retiree option change period. Enrollment in Medicare Advantage is subject to CMS approval. The Medicare Advantage PPO plan features include access to any doctor or hospital in the country as long as they participate and accept Medicare. Exclusive programs are available through United Healthcare, including house calls, which provide an in-home health and wellness visit from a licensed healthcare practitioner. Solutions for caregivers, which makes caring for a loved one easier. HI Health Innovations, which provides savings on the cost of hearing aids. Pharmacy Saver, which provides additional savings on many generic drugs at participating pharmacies. And Quit Power, which can help members quit smoking. Both the standard and premium plans include prescription drug coverage. You will have access to over 65,000 pharmacies, which includes all of the national chains, plus local and independent pharmacies. In addition, there is a bonus drug list that covers some medications not typically covered by Medicare. Further, United Healthcare offers additional programs, including a $0 copayment for select generic drugs and limited copayments while in the catastrophic coverage phase. On the screen, you will find an explanation of Medicare Advantage PPO coverage and the impact of having Medicare for retirees who are 65 and older. If you stop paying for your Medicare Part B coverage and/or enroll in a non-SHBP Medicare Advantage plan, such as a Medicare supplemental plan or Part D prescription plan, then your Medicare Advantage coverage under SHBP will be terminated, and SHBP will move you directly to the United Healthcare Health Maintenance Organization, HMO, option. You will subsequently be responsible for 100% of the premium. If you do not have Medicare Part B, then you may enroll in the Gold, Silver, or Bronze Health Reimbursement HRA options, High Deductible Health Plan, HDHP, or Regional HMO plan options. Now let's take a closer look at some of the more common benefits and what you will pay in 2015. Your monthly plan premium will be $25.38 for the standard plan and $88.22 per month for the premium plan. There are no changes to your plan deductible and annual out-of-pocket maximums for 2015. Your co-payments and coinsurance for doctor's office visits, inpatient hospital, outpatient surgery, lab service, and emergency care also remain the same as 2014. Let's also take a look at what your prescription drugs will cost. This is what you will pay for a 1-month supply at a retail pharmacy. All generic drugs will be in Tier 1, as mentioned. Select generic drugs will now be available at a $0 copayment. You will be able to find a list of these drugs in the additional drug list that is part of the plan materials you will receive from United Healthcare. Similar to your medical benefits, the co-payments for each tier will remain the same. This slide outlines what you will pay if you receive a 90-day supply either through mail order or at one of the many retail pharmacies that have agreed to provide 90-day supplies at the same cost as mail order. United Healthcare offers additional programs that can help you save, including HI Health Innovations, a program that offers digital hearing aids starting as low as $599 each. Additionally, United Healthcare offers programs to save on prescription drugs, including the Pharmacy Saver program, where you can get other generic drugs for as low as $2 at participating pharmacies. United Healthcare has expanded the number of retail pharmacies where you can get a 90-day supply at the same cost as mail service. In 2013, United Healthcare introduced house calls to SHBP members as an opportunity to have an in-home visit with a licensed healthcare practitioner as a way to complement regular doctor care. Programs like Silver Sneakers can help you stay active, both mentally and physically. If you are eligible and interested in enrolling in a non-Medicare Advantage plan option, there are new options available for the 2015 plan year. SHBP has expanded its plan options and vendors for the 2015 plan year. In addition to Blue Cross Blue Shield of Georgia, United Healthcare and Kaiser Permanente were selected to provide SHBP active and retired members additional choices for 2015. Retirees can choose one of the following plan options: statewide HMO offered by Blue Cross Blue Shield of Georgia and United Healthcare, a regional HMO offered by Kaiser if eligible, gold, silver, or bronze health reimbursement arrangement or HRA without co-payments offered by Blue Cross, or a high deductible health plan or HDHP offered by United Healthcare. Express Scripts will administer pharmacy benefits for Blue Cross, Blue Shield, and United Healthcare members for non-Medicare Advantage plan options. Healthways will provide well-being resources and wellness incentive programs for Blue Cross, Blue Shield, and United Healthcare members for non-Medicare Advantage plan options. For plan year 2015, SHBP is also providing enhanced benefits for certain covered services within the non-Medicare Advantage plan options. For members diagnosed with autism, SHBP will provide coverage for applied behavior analysis, or ABA, therapy, with a maximum benefit of $35,000 per year through the age of 10. The Georgia legislature established a bariatric pilot program to provide benefit coverage for certain bariatric surgical procedures for the treatment and management of obesity. The pilot is limited to 75 non-Medicare Advantage members total. Qualified applicants will be randomly selected by the vendor with whom they enroll. Please contact your selected vendor for more information. For hearing aids, the benefit allowance has increased for children up to age 19 from $1,500 to $3,000 every 5 years. SHBP is continuing to promote health and wellness through the provision of incentive accounts. These accounts will house well-being incentive credits that accompany both statewide HMO, Blue Cross Blue Shield of Georgia and United Healthcare, and HDHP plan options. Credits can be earned by completing certain health actions. These credits can be used to help offset certain health care costs such as co-payments and deductibles. Members who choose the Kaiser Permanente Regional HMO will have various wellness incentive programs to choose from that are administered by Kaiser Permanente. Members who complete certain health actions will be eligible to win an iPad and a Fitbit. Now let's learn more about how the different non-Medicare Advantage plan options that are available to you in 2015 will work. An HRA provides first dollar coverage for eligible medical and pharmacy expenses. This account is funded by SHBP. Additional well-being incentive credits can be earned and placed in the HRA account. These credits can help cover expenses for certain covered services and will be used to help meet your deductible and out-of-pocket maximum. Certain drug costs are waived if SHBP is primary and a member actively participates in a disease management program for diabetes, asthma, and/or coronary heart disease. It is important to note that if you do not enroll in an HRA plan option in 2015, any remaining HRA credits from 2014 are forfeited. Also, if you experience a qualifying event during the plan year that results in a plan option change to an HMO or HDHP, then your HRA credits will be forfeited. The HDHP offers in-network and out-of-network benefits and has a low monthly premium. However, you must satisfy a high deductible that applies to all covered medical and pharmacy expenses except preventive care. If you have any dependents, the entire family deductible must be met before benefits are payable for any family member. Also, you may qualify for a health savings account, HSA, to set aside tax-free dollars to pay for eligible health care expenses. The HDHP plan features are as follows. Plan pays 100% of covered services provided by in-network providers that are properly coded as preventive care. You must meet separate in-network and out-of-network deductibles and out-of-pocket maximums. You pay coinsurance after meeting the entire deductible for covered medical and pharmacy expenses. There are no co-payments. The HSA cannot be combined with a flexible spending account, or FSA. The statewide HMO vendors are Blue Cross, Blue Shield of Georgia, and United Healthcare. An HMO allows you to receive covered medical services from in-network providers only, except for emergency care. Be sure to verify your current provider is in-network before selecting an HMO plan option. The HMO plan features are as follows. Plan pays 100% of covered services provided by in-network providers that are properly coded as preventive care. Certain services are subject to a deductible and coinsurance. You are not required to obtain referrals to see a specialist, but are encouraged to select a primary care physician to help coordinate your care. The medical and pharmacy out-of-pocket maximums are combined. Co-payments count toward your out-of-pocket maximum. Certain drug costs are waived if SHBP is primary and you actively participate in one of the disease management programs for diabetes, asthma, and/or coronary artery disease. The Kaiser Permanente Regional HMO plan option is available to SHBP eligible retirees who live or work in one of the 27 counties within the defined Metro Atlanta service area. Please review the list provided on the screen to determine if you are eligible. The Kaiser Permanente plan features are as follows. Plan pays 100% of covered services provided by in-network providers that are properly coded as preventive care. Kaiser Permanente administers the benefits for medical, pharmacy, and wellness. No deductibles. The medical and pharmacy out-of-pocket maximums are combined. Co-payment only option. Express Scripts administers the prescription drug pharmacy benefits for members who choose non-MA plan options with either Blue Cross Blue Shield of Georgia or United Healthcare. Express Scripts provides benefits for retail prescription drug products, mail order, home delivery, and specialty pharmacy services. Get up to a 90-day supply of your maintenance medication either through Express Scripts home delivery pharmacy services or at a participating 90-day retail pharmacy. Express Scripts offers several programs for managing your prescriptions. The MyRx Choices Prescription Savings Program lowers out-of-pocket prescription costs. The Worry-Free Fills program offers automatic refills for long-term medications and will be automatically shipped to you. The Extended Payment program extends home delivery payments over 3 installments. As we highlighted earlier, SHBP is continuing our focus on your well-being. As such, a wellness component will be available with each non-Medicare Advantage plan option for the 2015 plan year. Let's take a closer look at how each vendor will be incorporating wellness. First, we'll take a look at wellness in 2015 for those of you that choose to enroll in a non-Medicare Advantage plan option with either Blue Cross, Blue Shield of Georgia, or United Healthcare. SHBP will continue to partner with our wellness vendor, Healthways, to provide members who elect Blue Cross, Blue Shield of Georgia, and United Healthcare with well-being resources and incentive programs. Health actions must be completed between January 15th and December 15th, 2015 in order to earn the well-being incentive credits. Members who elect Blue Cross Blue Shield of Georgia and United Healthcare will have access to a variety of Healthways tools, activities, and services such as the well-being assessment, wellness incentives, well-being coaching, biometric screenings, and on-site activities. Healthways will also administer 2015 action-based wellness incentives that will allow you to earn credits for offsetting certain healthcare costs. Members can earn up to 480 well-being incentive credits toward medical expenses, plus an additional 480 for a covered spouse, a total of 960 per household. Retirees and their covered spouse enrolled in a non-Medicare Advantage plan option with either Blue Cross Blue Shield of Georgia or United Healthcare can each earn an additional 480 well-being incentive credits by completing the following steps. Step 1. The Well-Being Assessment, or WBA, is an online questionnaire. Completing your WBA is required before any additional well-being incentive credits can be earned. Retirees complete the required biometric screenings either at an SHBP-sponsored event or by visiting their physician and having their physician complete the physician screening form. 240 well-being incentive credits can be earned. Step 2. In the next step, the retiree will choose the path they wish to follow. The telephonic coaching pathway, 240 well-being incentive credits, or online coaching. For the online coaching pathway, retirees will earn 40 well-being incentive credits for each online coaching tracker they use over a 6-month period. The maximum any retiree or spouse can earn in the coaching pathway is 240 well-being incentive credits. For example, the retiree completes the online exercise tracker 5 times within 4 consecutive weeks and earns 40 well-being incentive credits. The retiree then decides to join the telephonic coaching pathway. Once the retiree completes and actively engages in the telephonic coaching, the retiree will receive 200 well-being incentive credits because the retiree has already earned 40 credits from the exercise tracker. The maximum that can be earned is 240 well-being incentive credits. So, for 2015, a maximum of 480 well-being incentive credits per retiree and covered spouse in total may be earned. That is a family total of 960 well-being incentive credits. Kaiser Permanente also offers wellness resources and programs. Retirees that elect Kaiser Permanente for their non-Medicare Advantage plan option can access a variety of tools, activities, and services such as the Total Health Assessment, biometric screenings, and healthy living classes. Also, as a part of the Kaiser Permanente Wellness Program, if you sign up on kp.org and complete one of the identified health actions, you will be entered into a monthly drawing for an iPad and a Fitbit to help you manage your health. If you have questions or need additional information regarding any of the discussed non-Medicare Advantage plan options, consult your Retiree Decision Guide for a list of the vendor contact information. The information provided in this presentation is a summary of changes for the 2015 plan year. It is intended only to highlight principal benefits. Please refer to the Retiree Decision Guide for more details. Rates, decision guides, and other information will be available on the websites listed on this slide by October 1st, 2014. Your retiree option change period is from October 27th to November 14th. During that time, we encourage you to take the time to verify your plan election. It is also a great time to review your demographic information, like address and phone number, to make sure it's correct and to update and verify your dependent information. If you have questions about the United Healthcare Group Medicare Advantage PPO plans, please give United Healthcare a call at the number listed. This concludes our overview of your 2015 plan year benefits. We look forward to continuing to serve our retirees. Thank you.